Social protection programs are typically designed to reduce poverty and vulnerability of households and individuals across the life cycle. And they include income transfers, skills training programs, investments in human capital, but they can also, social protection programs and systems can also promote household resilience prior to crisis and help deliver relief and recovery post-crisis, and therefore is relevant to our conversation today. Ex ante, social protection programs can promote household resilience by transferring income skills that can help build assets, increase investments in human capitals, and therefore prepare households to better cope with shocks and crises. Ex post, the programs and systems can also be used to deliver relief and recovery. And using the systems that already exist, by scaling up existing programs, the delivery of relief and recovery can be faster, more efficient. And so essentially, adaptive social protection means mobilizing existing programs and systems to promote household resilience prior to disaster and deliver relief and recovery in a more efficient manner after crises. Why are we talking about adaptive safety nets? First, of course, because social protection programs can be used to promote household resilience. But the second, more important aspect in terms of delivery of relief and recovery is that if we use existing programs, the delivery of relief can be faster and more efficient. And here what I mean is if we use existing systems, and by delivery systems I mean information systems, beneficiary databases, outreach and enrollment processes, payment systems, bank accounts, GRM, grievance redress systems. So instead of creating new systems after disasters, identifying, creating new beneficiary databases, new bank accounts, which we typically tend to do after disasters, if we rely on existing ones and build on that, we save time and resources. Second, typically social protection programs are targeted at the poor and vulnerable. So the program databases already have the list of poor, which are normally the ones which are more effective during disasters. So if we can ensure those households receive relief and recovery, we ensure inclusion of the most vulnerable. And from our own experience with the 2015 earthquake in Nepal, there were studies that showed single women and Dalit households tended to be left out. So if we use the beneficiary database which target these population, we would make sure that these the communities and individuals are included. And third aspect of sort of delivery of relief and recovery post-disasters is that using the same social protection tools and instruments, we can deliver livelihoods that are impacted by shocks. So all social protection is not necessarily adaptive if they don't have certain features. What do we need for social protection programs and systems to be adaptive? There are three building blocks that we talk about. One is information. The information systems have to be adaptive. Second is adaptive programs. Third, finance. And then the institutional setup to actually make this happen. So under information, what we're talking about typically is integrated social registries, or at least beneficiary databases that are digitized, which would help identify beneficiaries of social protection programs in normal times, and identify the poorest and vulnerable that need to be targeted after disasters. Under information, we also talk about early warning systems, which should be linked to social protection programs, so the relief and recovery can be better planned and prepared for. Under adaptive programs, what we mean is social protection programs that are scalable by design. And scalable means programs that can expand as needed. And here we talk about two types of scalability, vertical and horizontal. Vertical means providing additional benefits to the same group of people that have receiving from before. Horizontal is adding additional beneficiaries to the program. And horizontal scaling up then requires identifying who those additional beneficiaries are, and that's where the social registry again comes into play. The third aspect is financing. For the programs to be able to be scaled up after crises, we need the financing pre-positioned and the fund flow mechanisms defined. Finally, for all this to happen, we need institutional coordination across a range of agencies, the social protection programs, ministries of finance, DRM agencies, the coordination mechanism with government leadership. Now coming to what social protection in Nepal looks like. I would say the social protection in Nepal is not yet adaptive, and I say yet because there are efforts underway to make it adaptive. When I say social protection, I'm referring to a portfolio of programs that includes social security allowances, which is the largest program in Nepal, which are categorical cash transfers to senior citizens, single women, persons with disability, children in certain Dalit households and in certain districts. The Prime Minister's Employment Program, which is a cash forward program targeted to the poor unemployed. There's a range of scholarships, midday meals, safe motherhood program, and a range of health subsidies. So if we look at these programs and the building blocks of adaptive SB, when we look at information systems, the beneficiary databases of the large programs are digitized in Nepal. However, there is no integrated database that connects all these databases together. So we don't have a database of households and their vulnerabilities identified. There's been progress in forecasting certain hazards, so in the early warning system, but impact-based forecasting is yet to be institutionalized, and forecasting of other hazards is still a work in progress. In terms of programs is, I think, where we face the biggest challenge in Nepal. The current programs are mostly categorical and they're not scalable. They have a fixed budget, they're targeted to fixed categories of people, and they're not able to expand to provide additional benefits or cover additional beneficiaries during crises. If we look at coverage of the program, they cover about a third of the population. But if we look at the coverage of those in the bottom quintile, only about 55% are said to be covered based on the last mixed 2019 survey. And the other aspect, if we're talking about household resilience, programs don't adequately focus on economic inclusion in Nepal. In terms of finance, the Disaster Management Fund has been established in Nepal. The operating guidelines have been recently approved. But these funds are not explicitly linked to social protection programs scaling up during crises. Finally, in institutional coordination, we have a DRM agencies that is trying to coordinate these efforts. The government is drafting shock responsive social protection guidelines, which I will talk a little more about in the next slide. But these need to be reflected in the social protection program guidelines as well. The other feature of sort of SB DRM conversation in Nepal is that recovery of livelihoods is largely missing from the conversation. When we talk about disaster response, it's often limited to sort of search and rescue and relief and reconstruction of housing that is damaged. The DRM legislation allows for a very broad definition of DRM, however the conversation is often limited. And therefore the impact on livelihoods caused by crisis is not measured at the household level and not responded to. And another point, particularly for Nepal, drought is a crisis in Nepal, but it's not really seen in the same light as flood or earthquakes or landslide, and therefore the response to drought is not really done at the same level. Now to come to the shock responsive social protection guidelines that the government is drafting, and that is supposed to help address some of these issues. The policy framework is supposed to help institutionalize shock responsive social protection and sort of create a framework for institutional collaboration. The proposed guidelines cover all types of shocks that have an impact on household welfare, irrespective of the nature of the shock. Natural disasters, economic shocks, and biological shocks as well, and therefore sort of crises in agriculture. The proposed guidelines talk about different types of assistance. As I said before, so far it's been limited to sort of immediate relief. In these guidelines, we want to talk about anticipatory assistance, which has been discussed in some of the sessions yesterday. Immediate relief, of course, but also add components of early recovery and rehabilitation of livelihoods. And these assistance would be based on damage and needs assessment, which would help identify the beneficiaries. As I said before, so far the damage has been limited to assessing damage of housing. Under this framework, we want to include sort of the demographic composition of the household, socioeconomic status, and damage to housing, as well as damage to crop, livestock, and
1 minute.
Thank you. I'll wrap up. And the impact on or the status of food security. The other aspect of these guidelines is this will define how the existing programs, particularly the two large ones, social security allowances and cash reward, will be mobilized to deliver these. And it also defines the role of local levels. My last slide, when we talk about food crisis, social protection programs have been used to respond to food crisis. The report also talks about the Productive Safety Net program in Ethiopia, Hunger Safety Nets program in Kenya, which are both food crisis response program are linked to drought monitoring and can scale up as needed. In Nepal, we had the Rural Community Infrastructure Works, a food cash reward program that started in the mid-90s. This was phased out when the Prime Minister's Employment Program was introduced. However, the Prime Minister's Employment Program is not designed as a scalable program and is not really linked to food security. It can be made to do so, which is a point I'd like to make. And the shock response to social protection guidelines, I think, will help enable that. And it would also need to establish coordination across various agencies, including Department of Hydromet, Agriculture, the Iron Agency, and the program itself. Thank you.